It began as an expedition cruise to the ends of the Earth. After 3 deaths, 12 cases across multiple continents, and a weeks-long international scramble, the ship at the centre of the world's first known cruise ship hantavirus outbreak has finally reached port. But the story is far from over. The MV Hondius, the Dutch-flagged expedition cruise ship that triggered a global health response, is arriving at the port of Rotterdam in the Netherlands, its home port. On board for this final leg, 25 crew members, 2 health workers, and the body of one of the passengers who died during the outbreak. Operator Ocean-Wide Expeditions confirmed that no symptomatic individuals remain on the vessel. Upon arrival, the ship will undergo a thorough cleaning and disinfection process, with specific protocols finalised in cooperation with Dutch health authorities. May 17th, the European Centre for Disease Prevention and Control reports a total of 12 cases linked to the outbreak, 9 confirmed, 2 probable, and 1 inconclusive. 3 people have died, and former passengers are now hospitalised or under quarantine in at least 12 countries: Australia, Canada, France, Germany, the Netherlands, St Helena, Singapore, South Africa, Spain, Switzerland, Turkey, and the United States of America. To understand how the world arrived at this moment, we go back to April the 1st, and a cruise ship setting sail from the southernmost tip of Argentina. The MV Hondius departed Ushuaia carrying 147 passengers and crew from 23 countries on an expedition through some of the most remote regions on Earth: Antarctica, South Georgia, Tristan da Cunha, St Helena, and Ascension Island. As early as April the 6th, passengers began falling ill. The first to die was a 70-year-old Dutchman who passed away on board on April the 11th. By the time the World Health Organization was formally notified on May the 2nd, the ship had been at sea for weeks, and passengers had already been dispersing across the globe. Investigators believe the virus was brought on board before departure. The leading hypothesis: the index cases, a Dutch couple, contracted the Andes virus during a months-long birdwatching trip through Chile, Uruguay, and Argentina, possibly picking it up near a landfill site in Ushuaia where they may have been exposed to infected rodents. That context is important. Argentina has reported 101 hantavirus infections since June of 2025, roughly double the previous year's caseload over the same period. What makes this outbreak so significant isn't just the virus itself, it's the strain. The Andes virus is the only known hantavirus capable of spreading from person to person, making containment aboard a vessel with nearly 150 people an urgent and complex challenge. Getting those passengers off the ship was not simple. The MV Hondius was denied entry by Cape Verde, which lacked the facilities for a safe evacuation. The Canary Islands initially refused the vessel as well, before Spanish health authorities ultimately approved docking. On May the 10th, the ship arrived at the port of Granadilla-de Ambona in Tenerife. Passengers wore blue protective clothing and masks as they were ferried by smaller boats to shore. Over 2 days, more than 120 passengers and crew of 19 nationalities disembarked in a carefully managed operation that Spanish Health Minister Mónica Garcia described as going according to plan. Evacuation flights then repatriated passengers to 6 European countries and Canada. American passengers faced a different journey. 18 people, 17 American citizens and 1 British national residing in the US, were flown home on a US government medical repatriation flight to Offutt Air Base Force. 18 people, 17 American citizens and 1 British national residing in the US, were flown home on a US government medical repatriation flight to Offutt Air Force Base in Nebraska. They were then transported to the National Quarantine Unit at the University of Nebraska Medical Center, where they are being monitored for symptoms. Up to the time of recording, no hantavirus cases have been confirmed amongst American passengers. The CDC has classified its response as a Level 3 emergency, the agency's lowest emergency designation, reflecting an active but contained situation. Even as the evacuation concluded, new cases have continued to surface, and health officials do say that was expected. The Andes virus has an incubation period of up to 6 weeks. That means passengers who felt perfectly healthy when they disembarked could still develop symptoms weeks later. Since the Tenerife evacuation, confirmed cases have been reported in France, where a passenger became symptomatic during their repatriation flight, and in Spain, where a passenger tested positive upon arrival but remains asymptomatic. On May the 16th, Canada reported that one of 4 repatriated passengers tested presumptively positive for the Andes virus. That individual was already under quarantine and is experiencing mild symptoms. Also worth noting, Washington State reported a separate hantavirus case last week that is entirely unrelated to the cruise ship, involving a person infected through rodent exposure. That strain does not spread between people. The ECDC has stated plainly, the identification of additional cases as former passengers return home is expected, and contact tracing is ongoing across dozens of countries. With cases now confirmed on multiple continents and the images of passengers in hazmat gear circulating worldwide, the question on many people's minds is this: could this become the next global pandemic? Public health experts have been consistent and clear. No. The WHO has emphasised that the risk of a broader epidemic remains low. The Andes virus does not spread through casual contact. Transmission requires close, sustained exposure, the kind that occurs in households, caregiver settings, or prolonged contact in poorly ventilated spaces. It does not spread like COVID-19. Andes virus outbreaks, though rare, carry a case fatality rate of 20 to 40%, which is why this situation has commanded such serious international attention. But past outbreaks have remained contained precisely because transmission requires that close contact threshold. As for the MV Hondius itself, operator Oceanwide Expeditions has said that the ship was scheduled to depart Iceland on May the 29th for a series of Arctic cruises. The company says it expects clarity on whether that sailing will proceed soon. No official authorization to sail can be granted until disinfection is complete and health authorities sign off. This is the first known hantavirus outbreak to occur on a cruise ship anywhere in the world. 12 cases, 3 deaths, passengers scattered across a dozen countries, now in quarantine, waiting to learn whether they were exposed, and a ship pulling into port carrying the final chapter of an outbreak the world will be watching for weeks to come. We will continue to track this story as new case results come in and health authorities finalise their disinfection and response protocols. From Faytuks News, stay safe, stay informed.
Thanks for visiting the Faytuks Network YouTube channel. For more, visit faytuksnetwork.com.